being able to address and fix cavities without drilling, because unfortunately, in dentistry, the drill is not a happy word for most. It usually invokes fear, trembling, many other emotions, strong emotions too. The ability to use SDF, or silver diamine fluoride, is really amazing. I've been using it for about a decade now, and I feel really comfortable with understanding its benefits and also its limitations. So this is something that I love going over and educating my parents and patients on, is how we can use this to treat things while they're small, treat cavities in a less invasive, less traumatic way, and then be able to just manage things better without having to go straight for shots and drills. SDF is truly a game changer in my mind for the kids who are age 0 to 5. Okay, so these are our young ones, and they typically are not cooperative and can be more on the fearful side. So having the ability to use SDF for small cavities, which it's the best and most effective for, typically the cavities that are visible, something you could see with your eye, right? Those do work the best. It also works for small starting cavities in between the teeth that we can see with x-rays, doing x-ray diagnosis. It's quite effective at that as well. But why the younger ones, why do I love it for that, is because it does a great job at managing and keeping the cavities small. And I always tell my parents, worst case scenario, is it going to delay the need for having to do a filling or a crown. And oftentimes, I'm using it for that express purpose, is to buy time, allow the child to mature, and then hopefully we can buy enough time where if we do have to do something later, like a filling or a crown, the kid is older, they're more mature, much easier to tolerate the treatment and be able to cooperate. SDF does stain. It stains the cavity, meaning the decayed area of the tooth, black. I mean, black as can be. So we don't shy away from that, and we actually pride ourselves in our office at communicating well with our patients. So we tell people up front when we're discussing the use of SDF that it will stain the cavity black, but it doesn't stain healthy tooth structure. So that will stay good. And we typically don't do it on front teeth, but if we do, obviously we are having that discussion as well. So SDF does stain the cavity area black. It is a permanent stain, but it's something that can be addressed and fixed later on. We can also do a filling later on or do other things to make it look better, more aesthetic later on. It does have, and I go over this with my parents too. We spend a long time in the exam. We go over a ton. It does have the capability with the proper home care, the proper hygiene, the proper diet, that you can hold off indefinitely. Like, you won't have to do a filling. You can even hold it off till the baby tooth falls out, and then you're good. And I've seen it in my own practice, and there's definitely studies about it. So the potential's there. But it takes the dedication, the work, So I do love minimally invasive dentistry. I've found that area, and I've done study and education over many years now in the area of minimally invasive dentistry. And although SDF gets a lot of attention, I do practice many other methods. I feel like I have many tools in my tool belt to address cavities. It's not just a one-size-fits-all, and I don't just see a cavity and say, let's drill it out, So we have a lot of options, so SDF being one, yes, but we now have an amazing dental laser. Its name is Solea, that I can do nearly 100% of my fillings now without injections, without the shot, which is really cool. Obviously, parents love it, patients love it, but that's been a great tool that fits in that minimally invasive category. We also use a material called Curodont. Now, Curodont is similar yet different than SDF. It uses a different technology, but what it's great for is very small surface level cavities. It can not only help stop the cavity from progressing and actually rebuild enamel. So it's really cool. Very nice technology that's very promising. And it does not stain like SDF, so that's another big benefit. So that's a great material. I also use iodine therapy, really just using it to kill more germs in the mouth and lessen the effects of surface level decay. And then I also practice a couple other techniques for the restorative side, meaning fillings and crowns. I use the ART technique, which stands for Atraumatic Restorative Technique. Basically, I'm doing a filling with little specialized hand instruments, once again, without the shots and without the drill. So we can do fillings in that way. And then I also place crowns, stainless steel crowns, so the silver colored crowns. I can place them also without shots and drilling. It's called the Hall technique. And it actually, the success rates are the same as if I did shots and drill. So pretty cool. What does it actually look like when we apply SDF for your child? The good news is it's simple and it's actually quite quick. Oftentimes when we're coming for a checkup appointment and we see the need for it, we can do it right away. So you don't even need an additional appointment for it. So the basics are we have to get the tooth and the area dry. We just use a little bit of cotton, maybe dry it with some air. And we use a little tiny brush. It's called a micro brush. It's kind of like a tiny Q-tip is what you could think of. And it's a liquid, so SDF is a liquid, so we just dip it in, little micro brush, and we dab it around the area, make sure that little decay cavity area is saturated with it. Let it sit for a minute, and then you can rinse, and then you're all done. So it's quite simple and quite quick. Tastes a little yucky, but we give the kids a lollipop at the end. Xylitol, not one that causes cavities.